Hello everyone, I am Dr. Federica Rizzo, neurologist from the stroke unit at the University Hospital of Val d'Hebron. In this video, I will talk about patent foramen ovale as a cause of ischemic stroke. The foramen ovale is a natural opening between the two upper chambers of the heart, the right atrium and the left atrium, that is present in the fetus heart before birth and allows correct circulation of oxygenated fetal blood during pregnancy. At the time of birth, under normal condition, the foramen ovale closes since the baby begins to breathe through the lungs instead to the placenta, as it has done until now. In many people, up to 1 in 4 healthy adults, this opening can persist into adulthood, allowing communication between venous blood and arterial blood. In most cases, this condition can be completely benign and does not cause any symptoms. In fact, even though the closure is not structurally complete, the pressure difference between arterial blood, where we find a higher pressure, and venous blood, where the pressure is lower, ensure a functional closure, decreasing the likelihood of communication between the two chambers. However, in some cases, this communication can allow the circulation of thrombi from the venous blood, where they are more frequent, to the arterial blood, reaching the entire body and, in particular, our brain, which is so sensitive to the lack of blood supply and cause a stroke. What condition increase the risk of having a stroke due to a patent foramen ovale? Well, all these circumstances that increase the risk of clots forming in the venous system. For example, situation of immobility, long travels without moving, and also genetic predisposition due to alteration in the coagulation system. And also those circumstances that increase pressure in the venous systems and favor the thrombus passing through the patent foramen ovale through the right atrium to the left atrium, such as effort, coughing, and defecation. After a stroke, it is very important to start a secondary prevention treatment to prevent a new stroke from recurring. In most cases, stroke due to patent foramen ovale occur in young people without other vascular risk factors such as high blood pressure, diabetes, or high cholesterol levels. However, it is always important to properly control these factors and maintain a healthy lifestyle. To reduce the risk of stroke, it will be also important to start medical treatment that consists of taking antiplatelets or anticoagulants, depending on each case, as assessed by your neurologist. When the patent foramen ovale is large or is associated with other specific structure abnormalities, it is likely that the decision will be made to close it through catheterization. That is, an intervention that is performed through catheters, which are tiny tubes that are inserted through an artery in the arm or groin and reach the heart, and that allow closing the communication between the two heart walls. For more information, do not hesitate to contact the neurologist of the stroke unit through the NeuroChat.